Good evening, everyone. Respected Dr. Padmanabhan, sir, esteemed members of IADPE, and dear doctors. A warm welcome to all of you to another enriching episode of Learn from a Master series, proudly organized by International Association for Dental Practice Excellence. Today's session is particularly special for all of us. We are proud and delighted to celebrate a significant milestone as we successfully complete our 100th webinar through this educational journey. Reaching the landmark would not have been possible without the unwavering support of our speakers, mentors, and participants who have been part of our learning community over the years. What began as a vision to provide quality dental education has now grown into a thriving platform that continues to inspire, educate, and empower dental professionals worldwide. As we celebrate this achievement today, we also look forward to many more webinars, workshops, and learning opportunities in the future. It is truly a pleasure to have you all with us this evening. Over the years, our Master Series has brought together dental professionals from various specialties, creating a platform for continuous learning, professional growth, and clinical excellence. We are grateful for the overwhelming support and positive feedback received through our webinars and social media platforms. For those who are joining us with the first time today, a brief introduction about IADPE, the International Association for Dental Practice Excellence, is dedicated to promoting quality dental education and helping dental professionals to achieve predictable clinical outcomes through continuous learning. We organize webinars, workshops, and academic platform programs aimed at enriching clinical skills, expanding knowledge, and supporting dentists through their professional journey. This gives the webinar a celebratory tone and highlights the 100th webinar milestone professionally. Today's session focuses on highly relevant and important topic, improving patient experience through conscious sedation. It is my privilege to introduce our esteemed speaker for the evening, Dr. Padmanabhan MY. Dr. Padmanabhan is a pediatric dentist, academician, and expert in sedation dentistry with over 10 years of clinical and academic experience. He has served as a former associate professor and has trained numerous dental professionals through various educational programs and institutions. His expertise in sedation dentistry and patient centered care makes him an ideal person to guide us through today's topic. Without taking much of your valuable time, I would like to invite Dr. Padmanabhan sir to deliver today's Master Series lecture. Over to you, sir. Welcome.
Thank you very much for that wonderful introduction, Dr. Sharan. And my heartfelt wishes on your 100th webinar. And I'm very, very glad that you're having me here for the 100th webinar. Thank you so very much for that. And once again, thank you very much to all the participants who have taken your valuable time to, I know you must all be very tired after your busy practice, but it's so wonderful that, you've taken time out of your busy schedule or out of your family to sit and listen to this topic. I'll try my level best to make it worth your time. Okay. So with that gratitude, note of gratitude, let us go ahead with today's topic. Okay. Uh, one of the important factors that we tend to miss in dentistry when we try to manage, when we are doing patient management, is anxiety. All right. See, anxiety is something that we feel even during a simple, when we're watching a cricket match, right? Imagine when the DRS system is on, we are anxious. In fact, if you can remember this scenario where India won the T20 World Cup, once you all remember this scenario, right? And about the match that happened in South Africa. I'm sure you guys remember this. I mean, where South Africa looked like it is going to win this game, and suddenly from nowhere, you will notice that somebody comes with a brilliant catch, right? I mean, I'm sure those who are cricket fans wouldn't have forgotten about this event actually, where like somebody very coolly just at the crux moment goes in, catches the ball, throws it inside, and then again catches it. I would say when he threw it and caught the ball, he didn't just catch the ball, he ensured that we get the cup, right? So that's all about anxiety management. When the patient is anxious, all that is important is that the doctor should have the relevant skill and tool to manage this anxiety. Okay. And we are just going to see why it is more relevant and why it is more important as we go through this lecture. Okay, so that's about today's lecture, how we are going to improve patient experience through sedation. So I am Dr. Padmanabhan. I graduated from Sri Ramakrishna Dental College and Hospital, Coimbatore. I did my BDS here. I was the first batch student of this college. And ever since then, I liked Coimbatore. And I was basically from Chennai, but then I liked Coimbatore and I settled down here. So once I finished my UG, I went on to do my post-graduation at King George Medical University, where I had the chance of, treating patients under sedation for the first time. In fact, my thesis was related to oral sedation. We used a lot of combination drugs to evaluate different types of patients. We had a total of about 135 sedation sessions during this particular research. As a part of my research, I had the opportunity during my post-graduation to visit many dental schools in US, and the most prominent among them were the University of Michigan in dentistry, in the Louisiana School of University, Louisiana State University, and then Boston. Now, when I visited these universities, what really struck me was that the third year undergraduate students were very confidently using inhalation sedation in their patients. So, which made me think as to why is it that we have this taboo here in our country. They were very confidently and coolly conducting sedation sessions in both children as well as in adults. And that's when I really felt, although my thesis was not related to that, I felt that when I'm practicing back in India, I'm definitely going to adopt this technology. And that was one of the major impetus or major inspiration for me to start sedation back home. So during my post-graduation, I had the opportunity to publish these papers. And ever since then, I had lectured at various levels to national conferences regarding sedation. I'm also a textbook author. I mean, I'm authored this chapter on sedation management, on pharmacological management of children in the Elsevier's textbook of pediatric dentistry. And yeah, so that's my practice. I'm a pediatric dentist, but I treat both adults and children. You will notice that in my practice, you would see me treating both adults and children. And I started this slide with showing a 93-year-old person. All right, I always start my presentation with the video of this gentleman because uh, more than Virat Kohli's 100 centuries, I'm not sure whether he's going to get it at any point of time or not, but I'm more eager to ensure to see that this person crosses his century and a century in terms of his age. And when he crosses that, I would want to, treat his dental problems under sedation to prove to the world that nitrous oxide inhalation sedation is one of the most safest modalities through which you can give dental treatment to even people who are very anxious, whether it be doing proper rubber dam isolation and treating a young child, or whether it be treating a very old patient, or whether you're doing a surgery, whether you're doing a simple extraction, there is always place for nitrous oxide inhalation sedation. And that's exactly how we work in our practice, whether it's implants or simple procedures, it's always under inhalation sedation. And we also have an academy where we teach students regarding related to inhalation sedation, oral sedation, intranasal sedation, along with my dear friend Dr. Ashwin Rao. I do conduct classes here as well. Okay. So we have had participants coming from all over the nation and even from outside India to attend these courses. And we've had a sedation sessions where we've teached people not just about sedation related to a particular company, but we focus on treating people teaching people about sedation, about all the sedation machines, all the sedation equipments that are available, which in turn would allow people to master the sedation holistically rather than sticking to a particular company's process. So that's about us. And in case if you are interested, we also have a course coming up shortly. So now let's get into the topic. Why sedation in dental practice? As I told you, one of the unexplained reasons, one of the unexplained or one of the unidentified facets of dental treatment that goes majorly unnoticed is anxiety, fear, and phobia. Okay. Uh, if you look at the way we were taught dentistry, all right, we were always, when we do a root canal treatment, we were always told to check whether, we reach the apical third, whether we have a tug back sensation, or in fact, the more recent concept is, whether, did you get an apical puff, or, whether you fill the lateral canals, is there a puff in the periapical region or along the surface of the root? So these are all the stuffs that you are actually made to evaluate. But have you ever been told that when you're treating the patient, have you ever asked the patient, sir or madam, how anxious are you during the, whether how anxious they were during the treatment? What was the specific steps that you took to ensure that the anxiety or the perception of pain or the perception or the fear factor that is there in these patients was minimized? So considering this, they found that it is because of this that even the American Association of Endodontists and many other groups came out with an outcome assessment sheet in which if you notice here, you will notice that, if you look at this particular slide, you will notice that it's just not about assessing whether the pulp space is healed, the periodontal space is healed, all right? You should also check whether your treatment or resulted in some form of dental anxiety for the patient. Okay, your treatment outcome, you cannot call a treatment successful, just merely by saying that the periapical space healed or the pulpal space was well managed, or you treated the discoloration. It's just not about that. You have to take, was your patient anxious while getting out of the dental chair? Was the patient still feeling anxious about follow-up treatment? See, if your patient is going to, get out of the chair with anxiety, with lots and lots of fear, then uh, your treatment, whether your treatment, you can call your treatment successful, is still questionable. So this is where I'm going to change all your perception related to treatment. The reason is because we've all been treated, we've all been trained in such a way. In preclinical conservative, we've been made to check like whether we reached just below the DEJ, whether we accessed all the canals without widening the access cavity. There are so many things that we've been taught. But when we came to patient management, all right, take some time to actually check if your patient is anxious. Are you really doing the treatment wherein the patient is pain free? Does your patient still harbor fear towards dental treatment? What are the steps that you've taken to mitigate these? Now let me tell you, my dear friends, these are important practice builders that can change the way your patients perceive treatment. Okay, there is research to even support that. All right, you may have the best of, you might have given the best of the local anesthetic injection, you may have the best of the procedures you could have done, but if the patient's anxiety was not managed, it was directly seen that it was proportional to the pain that they perceived during dental treatment. Anticipatory anxiety is proportional to the pain perception. So if you notice here, let me just show you the video of how we managed a patient here who had trauma. Now, a small tip that I would give you all is that, see, whenever you're managing a patient with dental trauma, okay, it would be great if parents can call us and tell us, sir, my child had an at least class 4 fracture or a class 3 fracture, or my daughter just suffered a complicated crown fracture. They're not going to use terms like that. They're always going to say the tooth got knocked out, the tooth is loose and shaking. They are also always going to use common terms like that. So the first and the most important thing, or the greatest service that you can do, especially when you're treating children wherein the parent calls up and says that there is a trauma in a child in the mixed dentition stage or a permanent dentition stage, is that just ask them to quickly come on a video call and look into the video. Okay, ask them to lift the lip up and show what is exactly happening below the lip. Okay. Now, if you notice there, the patient told me that the tooth fell off. But when the patient lifted up the lip and when I saw it, I knew this that the tooth that actually got avulsed was a primary canine. So I knew that it was not an issue. Because had it been a permanent central incisor, I would have asked the mother then and there to put the tooth back into the socket, or I would have given instructions on how to take care of the permanent teeth so that you can reimplant it successfully. Okay. So now that I found that this was the status, okay, this is a more refined status, the child was bleeding all over and all that. I noticed that there was just a lateral luxation of 2-1 and 2-2, and an uncomplicated crown fracture of 1-1, and there was avulsion of 6-3. So what I usually talk or tell about trauma management is that, see, restorative management is like a date. All right. Your patient comes to you, you just fill the tooth and then they just go back. That is all. It's like a date. Okay. Whereas trauma management is like marriage. All right. The patient first comes to you and you do emergency splinting and probably you initiate root endodontic treatment. And thereafter, in the next appointment, you complete endodontic treatment. And then you call them for sealing the access cavity. In the course of this treatment, your patient may develop discoloration, so you're trying to manage that. Now, during your splinting, if the tooth was not properly splinted or if the patient's occlusion is not sitting properly, you may have to do some mild orthodontic correction. If there was discoloration, you may have to manage it with bleaching. And after finishing endodontic treatment and good healing of the gingival region, everything is achieved, the occlusion has become stable, you may have to think in terms of the prosthetic management part. So you can see that it's not just a simple treatment. All right. The treatment just moves on. Okay. The treatment goes on into multiple steps. So how do you ensure that your patient trusts you through the process? All right. How can you make the patient more motivated to ensure that they complete the treatment? One of the most important aspects that can help you do is the steps that you take to minimize pain and anxiety during the first dental treatment through effective communication, through the use of sedation. You will notice that when you build that trust, it goes a long way. So in this child, that's what we exactly did. We managed the dental treatment under sedation. Once the parent sees that the child is calm like this on the dental chair, all right, the parental anxiety kind of goes down. All right. So this is once again a beautiful practice builder. And we went on to do splinting of this teeth, which is the immediate emergency management that was required. And I'm sorry I didn't edit these videos to reduce the blood and all that, but this is how you know, obviously, how it's going to be during trauma. And then we noticed that the child did not manage the oral hygiene well, so we did oral prophylaxis. We then placed intracanal calcium hydroxide for 2 weeks in the tooth that was laterally luxated. And then we restored 1-1 with pulp protective liner and composite resin. So you will notice that you can see we were able to achieve reasonable aesthetics in 1-1 with composite resin itself. You can see that. But of course, 2-1 and 2-2 achieved discoloration. So we went on to do bleaching for this patient. And then eventually now the patient is on aligners to correct the mild TFO that's actually present in her dentition right now. So you will notice here the point that I'm trying to make here is that you have to understand that dental trauma management or dental management, when you take exceptional measures to minimize pain and anxiety in the first step, you will notice that when you secure the patient's trust, the patient is yours forever. Okay, so that's the message that I would want you to take home. This is another patient. I've reduced the volume of the video. This was a young girl, she lost her teeth just around COVID time. And it just happened that she was very happy during COVID because, she could wear the mask and hide the teeth. She didn't have to necessarily go and replace the tooth. Okay. But eventually, when the masks had to come out and when she had to show her teeth, she was definitely feeling very anxious about it. And she already had anxiety because of her childhood dental experiences. And we went on to manage. Okay. So effective communication coupled with sedation can actually make even many adults accept dental treatment. Thereafter, we've done a lot of dental treatment. She's now undergoing aligner therapy with us as well. So you will notice that all this becomes possible because of how we manage the patient, how we communicate with the patient, and how the tools that we use to minimize pain and anxiety. So if you think that sedation is only to manage uncooperative behavior in children, let me correct you, it's not like that. Okay. So we went on to do some osteodensification, and then we went on to place dental implants, and that's how we managed this patient. The next important thing where sedation can really help you is in managing fatigue of the patient. Okay. You know that some dental treatments can go on for hours together. And of course, between the treatment itself, the patient may start thinking as to why did I even sign up for this? All right. So it's a proven fact that that sedation can help in reducing fatigue during dental treatment. Let's say you're doing an all-on-4 or an all-on-6 procedure with complete extraction, all right, in a patient. Sedation makes the procedure more comfortable in the sense that you will notice that the patient is not experiencing fatigue during the dental treatment, and his compliance, patient compliance becomes much more better during treatment. Now, this is another child, I mean, is a very common scenario that you would be facing in your day-to-day practice, wherein a child reports to you with a complicated crown fracture, meaning a crown fracture with pulp exposure. But you know that patient take their own sweet time to report to the dentist. They go probably check with the eye doctor for the problem, then they check the ENT if there is any complication because of trauma. They may even go to the plastic surgeon for that matter, and then at last they come and visit you, the dentist. All right, this is something that happens very, very commonly, right? Doctor, am I audible? Is it going fine so far?
Yes,
Doctor?
sir. Yes,
Yeah,
sir.
great, great, great. Thank you. Thank you so very much for the feedback. If in between you're not able to listen or anything, just let me know. So you will notice here that this is a very common scenario that can happen in your dental practice. So all that you have to do is, I mean, we ask this patient, okay, like, where is the broken fragment? The most common reply the parent tells you is that, sir, the broken fragment was missing. All right. So I again asked the patient, you have to tell me where the broken fragment is. The patient still said, no, sir, we don't have the broken fragment. Then I had to use the typical Indian way of telling things where I had to tell them that, see, if you have the broken fragment, the treatment is X. If you don't have the broken fragment, the treatment is going to cost you 3X. So immediately you notice that the patient, in fact, the parent would go back home. They know exactly where this broken fragment, because, we all have this practice, right? Whether a part of the body is gone or the whole body is gone, we go safely bury it in one place. So they had buried and kept the broken fragment in one place. So they dug. In fact, they will even get you 10 or 15 fragments, and they'll tell you to even choose the best out of these. Okay. But anyways, jokes apart, they gave us this broken fragment and we disinfected it. We found that it was fitting fine. And of course, you will notice that the child was slightly tense and which was mildly uncooperative. But again, with sedation, we were able to deliver excellent painless treatment. We were able to do rubber dam isolation properly. And under proper rubber dam isolation, we checked the fit of the disinfected fragment. It was fitting fine. But the key here is how to manage the pulpal part, the endo part. The moment we excavated the most superficial portion of the pulp, I could find that I am able to see good, healthy, vital pulp. All right, so I decided to do a partial pulpotomy with biodentine. So I went on to do partial pulpotomy with biodentine. But the issue here is that, see, the difference between doing a pulpotomy in a child who needs fragment reattachment and a child who's going to go in for a crown or a restoration, I mean, wherein you do a pulpotomy after caries, there's a difference between these two. The problem here is that in case of dental caries, you're going to excavate caries, you do a pulpotomy, and then you can quickly put an RMGIC liner on top, and then you restore it with composite, or you do a core buildup, give a good crown on top of it, or you can give a good overlay on top of it. Your treatment it goes on smooth. But in case of fragment reattachment, you just like that cannot put a liner, because if you put a liner, the fragment would not attach properly. So we had to wait for the biodentine to actually set. After the biodentine sets, we etched the tooth, the tooth portion. We etched the fragment as well. we did air abrasion, and then we went on to bond, and this was the result that we could achieve with fragment reattachment. This was the immediate post-operative pic that was taken after the fragment reattachment. If you have not done fragment reattachment in your clinic, I would suggest that you start working on it. Now, the idea behind putting this case here was that you can imagine with the rubber dam, the child had to wait 12 to 13 minutes, all right, until the biodentine could set. Okay, so all this is feasible, all right. I mean, you can imagine the fatigue that the child or the adult might go through during this phase. Nitrous oxide inhalation sedation can ensure that your patient's fatigue or perception of pain is minimized during this crucial phase. All right, and the acceptance is much better, the compliance is much better. So that's where the sedation plays a very important role in lengthy dental treatments as well. All right. So that's about the treatment that we did for the child. We reattached the fragment, and you could see that we could achieve excellent aesthetics simply because of the fragment was there. And we have research to back this as well, not newer research, research as old as 1986, where they say that I mean, the introduction of sedation by eliminating or reducing fear and anxiety not only elevates the pain threshold, but it also mitigates fatigue. So that's why, you know, when you're treating children, it's not just about doing one single crown or one single filling. Always, I tell my participants, aim for a full arch or aim for a quadrant at least when you're treating patient under sedation. Thereby, you're ensuring that your revenue per time spent is also improving, and the patient, it also justifies the use of sedation, because when a patient pays extra for sedation, they know at least that they're able to, their child is able to, you know, undergo a lot of dental treatment within a shorter span of time. Okay. The next reason why you need sedation is to protect the developing psyche or to prevent potential harm. Now, if you collect a group of 15 students, okay, whenever I give a lecture, the first question that I ask people is that, why do you think you require sedation? The most common answer that participants give me is, sir, children are uncooperative, and that's why. So, you know, uncooperative children tend to leave a very big, impression in our brain that, if you find a child shouting and screaming, the whole day that the scream or the fear, the shout keeps ringing in your ear. All right. And sometimes when you think about it also, you can see that your heart is slightly, a point, the number of beats is probably has a mild tachycardia there for you also. Okay. So even in our curriculum, we've always felt taught about non-pharmacological behavior management. And then there is something called pharmacological behavior management. We have always been told, try non-pharmacological first, and then if it doesn't work, then go to pharmacological. That's what we've been taught in our school, college as well, right? Now I'm here to change that mindset. All right. Why should you wait for somebody's behavior to deteriorate? Why should you wait for someone's anxiety to go through the roof and then tell them that, look, I have nitrous oxide inhalation sedation. Let me use it for you. You'll feel more comfortable. Why should you do that? Why is it that we cannot give them a good experience initially itself? Okay. Like, let's say, you tell the patient that you have to report for scaling every 6 months. All right. Now imagine what the patient is thinking. Oh my God, that machine running through my teeth, and that vibration that goes around my teeth. Oh God, should I have to undergo this every 6 months? It's like the patient will think that, okay, I'm going and paying for some torture. The patient would pay twice the amount and sit in a hot sauna. All right. But he will think twice about, should I just pay that few thousand rupees and again make that instrument vibrate around my teeth? But instead, if you can make that experience more pleasurable, more good, all right. Uh, I mean, in the initial setting itself, there is some motivation for the patient to come back. So that's why I tell my participants that don't wait for the behavior to deteriorate. All right. Don't wait for the behavior to deteriorate in order to start sedation. All right. Even if the child is good, when the child is good itself, you go ahead and do the dental treatment. All right. So this was just, I was telling you, all right, you may be happy that you got a perfectly done root canal treatment. But if the patient felt like, oh my God, it was a horrible experience opening the mouth and the doctor was putting like this and that, I mean, at the end of the day, if the patient thinks it's a horrible experience, I mean, whatever good root canal treatment you've done, it goes for a toss. The patient is not going to come back. All right. So don't wait for somebody to tell you that, uh, you know, the, the behavior is for the behavior to worsen or their anxiety to go through the roof before starting sedation. Now, this is a very normal child. I mean, as in, this is a very cooperative kid, but I'm still using sedation because I want to give her a good experience. All right. A typical, this is just a routine dental treatment for me. Like I do a preoperative scan, and then she needs to undergo a small minor surgery wherein I have to extract the retained primary incisors. And after extracting the primary incisors, I'm elevating the flap and extracting the impacted mesiodens. And after removing the mesiodens, we are just waiting for the central incisors that have been impacted above the mesiodens to erupt. The child is already 8 years old. So this child is a very cooperative kid, and you'll notice that even just because a child is cooperative doesn't mean that we should take them for granted. Give them sedation, use nitrous oxide inhalation sedation, and give a wonderful experience for these kids. All right. So that's my message for you. Okay. You will notice that the patient goes out of the chair happy, and that's and the child develops a more positive attitude towards dentistry. All right. So providing pleasant experience. Okay, providing pleasant experience even during. So this is a simple third molar extraction. All right. The patient is happy, relaxed, and you can see that the patient is sedated, but still is interactive. He'll tell you whether the sedation, like anesthesia, is working or not. You can very peacefully do the impacted tooth removal. You can just improve it a top notch. I mean, you can go to a better level itself. All right. In fact, under sedation, you will notice that your patient listens to you in a better way. Don't get me wrong. Don't discuss the treatment plan under sedation. Okay. What I'm trying to tell you is that your patient is going to listen to you better if you tell them to open the mouth, turn to the left, turn to the right, remain in this position. You will notice that under sedation, it improves suggestibility as well. And again, this has been uh, proven through valuable research. Okay. And this was a patient who was referred to me for management of gag reflex. Uh, I mean, uh, the patient had severe gag that although he was ready and willing to do dental treatment, you will notice that he went and extracted a first permanent molar because he could not withstand the instrument going into his mouth. So he just felt that for the control of pain that he's not interested in going for an RCT, he'll somehow just get the tooth extracted. And now the same problem was there in the second molar as well. And he was like, I mean, should I get even this tooth extracted? You can see he's a young patient. I was not able to even put the mirror, inside his mouth or even the X-ray. But again, under a higher amount of nitrous oxide inhalation sedation, you notice that I was able to place a rubber dam properly. We were able to do root canal treatment, and I was able to do a proper core buildup for him in the second molar. Now, after being confident about this, he even accepted for doing dental implant in the previously extracted first molar site. All right. So, as I said, all right, the moment you gain the trust of the patient, you will notice that the patient becomes more and more confident. You will notice that nitrous oxide inhalation, sedation at a slightly higher level of sedation, at a slightly higher level of nitrous oxide level will, in fact, allow you to manage the gag reflex also very, very well. All right. So we went on to place dental implants in the first molar region. And that's about the treatment. Okay. So, and then we've successfully made the prosthetic rehabilitation as well. Not only that, it's been even proven that nitrous oxide potentiates the action of local anesthesia as well. So you will notice that, there is a lot of research that tells you that nitrous oxide inhalation sedation can increase the success rate of pulpal anesthesia. And there are multiple researchers to prove the same. In fact, this is an excerpt from the Malamet's recent edition of Textbook of Local Anesthesia. In fact, for management of hot pulp, Malamet suggests that you have to, if you can use buffered articaine along with inhalation sedation, it can probably help you with management of, severe acute irreversible pulpitis as well. So this is again from Malamed, all right, where he tells about how to manage pulpally involved mandibular teeth. The chart is there for you to see, wherein he's mentioned about nitrous oxide in all the slides. So now the next logical question is that, isn't nitrous oxide inhalation sedation risky? All right, that's the question that you may pop up in your mind. So for this, I'm going to, probably talk about a small amount of theory here, a little bit of theory here to make you understand why nitrous oxide inhalation sedation is safe and not to believe what anybody else might actually tell you regarding nitrous oxide inhalation sedation. Okay. Now, if you look at sedation, many people think sedation is becoming unconscious. All right. But that's not exactly sedation. There are different levels of sedation. You have minimal sedation, you have moderate sedation, and then you have deep sedation. Okay. Now, what is minimal sedation? A minimal sedation is nothing but a drug-induced state during which patient will respond normally to your verbal commands. All right. Emphasize on the word normally. Okay. So you will notice that, here it's just a routine implant dental treatment for me. If you notice how the patient is responding to me during dental treatment, we are delivering the anesthesia as painlessly as possible, and we are asking the patient, is it paining? The patient is able to respond. The patient is able to open the mouth when we ask her to open the mouth. She's able to give a verbal response. All right. So this level of sedation, where your patient is able to provide you a verbal response, is what is called as minimal sedation. Now, earlier, this particular level of sedation was referred to as anxiolysis. We don't use the term anxiolysis anymore. The right term for this is minimal sedation. The next level of sedation is moderate sedation. All right. This was what was called as conscious sedation. Actually, the term conscious sedation is obsolete. You're not supposed to use the term anymore. All right. The right term right now is moderate sedation. But we still use this term because that's what many of us, many understand. But sedation has become popular by the term conscious sedation. So we still use this term. But the right scientific terminology is moderate sedation. Now, what is moderate sedation? If you notice here, the patient is not telling me the name when I ask him for the name, but when I ask him to open the mouth, the patient will be able to respond and open the mouth. Now, this is a child with Down syndrome who we are managing under sedation. So the important point here is that, the most important point here is that the patient will respond purposefully to your commands, meaning he may not give you a verbal response. You ask him his name, he may not tell you what his name is. He may not give you a sentence, a reply as a sentence or as phrases, but instead he would shake his head and reply. He would say yes, no, or he would open the mouth. If you tell him to turn to the left or turn to the right, they will respond purposefully, but they may not respond they may not give you a verbal response itself. Now, this level of sedation is what is called as moderate sedation. Okay. Again, this is just another case where you will notice, you can see here, where the patient is able to respond purposefully to you. All right. Okay. Now, what is the next level of sedation? Deeper sedation. In deep sedation, you will notice that, you have to, the patient is not responding normally or purposefully. You have to give him a repeated tactile stimulation. Now, if you assisted oral surgeons when they do IMF, sometimes they give a bolus midazolam injection. And then what they do in IV sedation is that they give you a bolus sedative, and then during the procedure, the patient goes into sedation, and you're hitting the patient on the cheek and telling, sir, open the mouth, sir, open the mouth. And then you're thrusting a mouth opener, and then you're pressing it in order to make him somehow forcefully open the mouth. So this level of sedation, wherein your patient cannot be easily aroused, but will respond following repeated or painful stimulation, is what is called as deep sedation. See, for example, if you notice this video here, the child is not responding to my commands, but I'm actually having to, move the head with my hand, and then I'm trying to, stimulate the jaw in order to make the child open the mouth. In fact, I'm telling my anesthetist that the level of sedation is a little too deeper here. So this level of sedation is what is called as deep sedation. All right. See, in an ideal world, it would be fantastic, for pediatric dentists especially, if we can treat all patients under deep sedation. Imagine the patient comes to the dental chair, goes into deep sedation, and we are able to do everything in one shot, like do all crowns, all root canals in one shot. We'll be the new implantologists, or we'll be the new, pediatric dentistry and a deep sedation would become the next greatest thing probably, right? But what is the caveat here? What is the caveat involved, or what is the negative thing in taking the patient always to deeper levels of sedation? You will notice here that The good thing is that the resistance from the patient will go down. Your child will not fight against you when you go into deeper levels of sedation. The response to painful stimuli may also come down. The patient is not going to respond much for painful stimuli, which is actually great. But the more deeper the level of sedation, you will notice that the ability of your patient to maintain his own airway will also go down. All right. What do I mean by saying ability to maintain airway is that, you see, we are able to breathe by ourselves. We don't require any support for inspiration and expiration, right? So in deeper levels of sedation, as you go into deeper and deeper levels of sedation, this ability to maintain your own airway or to maintain ventilation by your own self, right? That means, in simple terms, the patient being able to breathe by themselves keeps going down and down and down. Okay, so that is the issue with going into deeper levels of sedation or GA. That's why in general anesthesia, the patient is intubated. Why? In a way, you are assisting the patient to breathe. Okay, the patient is not able to breathe by themselves. So deep sedation is almost, when you go into deeper levels of sedation, you're getting one step closer to GA. That is the issue. All right. So it's beautifully summarized in this table. You will notice that in minimal sedation and moderate sedation, to just summarize what we learned, you know that there is normal response to verbal stimulation, whereas in moderate sedation, there is purposeful response. What you have to notice here is that you do not require any form of airway intervention, meaning in minimal and moderate sedation, your patients can breathe by themselves. Your patient can maintain their own ventilation. Whereas in minimal and moderate sedation, your patient can maintain their own ventilation. No airway intervention is required. Whereas in deep sedation, you will notice here that airway intervention may be required. And in general anesthesia, airway intervention is usually required. Are you all with me? I hope you understand this. I mean, if you're able to follow what I just said right now, it would be great if you can just tap yes in a chat. It would be fantastic if you can just give me a yes or a thumbs up in the chat. I'll be glad that, okay, people are just following whatever I'm trying to tell you. I hope the chat option is open. Okay. Let me just check that. I mean, are we getting some messages? Are we getting Dr. Sharon, are people telling yes, or what are they? How is it like? I'm sorry. All right. I'm getting a lot of messages. I'm definitely, there are people saying yes, and great. So assuming that you all are following what I'm just telling you right now, minimal and moderate sedation, no airway issues. Your patient can breathe by themselves. Deep sedation and general anesthesia, the issue is that the ability to maintain airway may keep going down. In fact, the cardiovascular function also is well maintained in minimal and moderate sedation, whereas in general anesthesia or deeper levels of sedation, you again may have some issue with this. Okay. So coming back to the level of sedation, I'm sure you guys now understand why we have this line here, right? I hope you guys understand this, because when the sedation is at is within this line, you will notice that minimal and moderate sedation, your patient is able to maintain their own airway. There are no issues at all. But when your sedation goes past this line, you will notice that the ability to maintain airway keeps going down. Okay. So which means that when you're doing a procedure under minimal or moderate sedation, you as a dentist can do it yourself. But when you're doing the same procedure, but when you require deeper levels of sedation, it's always better done in the presence of an anesthetist or some other person or some other specialist who knows how to maintain the airway. Are you all with me? I hope you understand this point well. Okay. So why is nitrous oxide inhalation sedation effective? It's effective because you will have to understand here that nitrous oxide inhalation sedation, even at the highest level, cannot induce deep sedation. You go introduce even 70% nitrous, the patient cannot go into deeper levels of sedation. That's why it is considered as one of the most safest type of sedation when compared to intravenous or even oral sedation. Even oral sedation looks very simple, but you can induce GA with oral sedation. Whereas with nitrous oxide inhalation sedation, you cannot take your patient into deeper levels of sedation. And that is the reason why it's still considered as a more preferred type of sedation. All right. And I'm just going to quickly go through these slides. Why isn't there any deep sedation with noise? I don't wish to enter too much into the pharmacology part. I mean, it's because of nitrous oxide, the values of MAC being very much higher. And we'll probably, when we get to meet, when we have a greater amount of time, we'll probably discuss this in more detail. All right. Uh, okay. Now, the next question is, if I induce nitrous oxide, will I be losing valuable chair side time? Will it take a long time to induce nitrous oxide inhalation sedation? Will it take a long time for the patient to come out of nitrous oxide inhalation sedation? Again, the scientific explanation is that nitrous oxide is a very poorly soluble substance. When you introduce it, when the moment it gets into the blood and goes to the brain, you will notice that, I mean, it is very poorly soluble. So you will notice that what can happen in a poorly soluble drug is that the moment you stop the drug, it immediately gets out of your body. It doesn't dissolve in the fat or extracellular or intracellular fluid, and it does not stay in your body. All right. It just quickly gets out of your body itself. For example, the case in point is, I want you to see this patient here. All right. This was one of the surgeries that we did recently. Now, a history about this patient is that this patient has a familial history of central giant cell granuloma and has already underwent 2 surgeries under general anesthesia. And this was his 3rd procedure. Okay. My friend, a good surgeon, he called up and asked me, I don't wish to do this child, put this child through another round of general anesthesia. Is there something that you can actually do for me? All right. I assessed the behavior of this child in my clinic. Told him, look, I think we'll be able to operate him under nitrous oxide inhalation sedation itself. So this child is only under inhalation sedation. All right. Not GA, not deep sedation, under minimal to moderate sedation. You can see, the child is just going through the procedure just with nitrous oxide. Okay. So this was the procedure as it is happening there. I mean, you'll notice that, we are able to excise, that surgeon is excising the lesion, the giant cell granuloma. I'm just going to quickly go through the slide for want of time. Okay. So after excavation properly, you can see that he's packing the iodoform gauze there inside the cavity, inside the surgical cavity. And you see, this is 10 minutes after the procedure. Just 10 minutes after the procedure, I'm interacting with this kid. I'm just asking him in Tamil, do you like ice cream? What's the ice cream of your choice? And the child is interacting with me just after that surgery. Okay. And 10-15 minutes after the surgery, you could notice that the boy is able to get up and walk out itself. See, that's the beauty of nitrous oxide inhalation sedation. All right. 10 to 15 minutes, the patient is into sedation. 5 to 10 minutes after the procedure, the patient can get up and walk out of the chair by himself. Okay. So that's about, so if you had any question whether sedation will cause time to whether the patient is going to require more time to come out of the procedure, or whether it will take a lot of time to induce the sedation, no, definitely no. And I'm just going to skip the theoretical points. Why do you require a special equipment to deliver nitrous oxide inhalation sedation? Now, if you look at almost all the equipments that we have for nitrous oxide inhalation sedation, you will notice that all the equipments are designed in such a way that at least 30% of the sedation mixture that the patient is going to inhale will always have oxygen. Okay. When we say nitrous oxide inhalation sedation, we are not giving 100% nitrous. Okay. We are giving a mixture of nitrous oxide and oxygen. And in that mixture, at least 30% is oxygen. All right. Most of the times it is usually 60 or 70% of the mixture is oxygen only. Whereas you will notice that if you cannot rig the machine to make the oxygen level go down below 30%. The machine is made up like that. Now, why is this important? Because if you notice, even the air that you inhale from the atmosphere has only 21% oxygen. Okay. Whereas the air that the patient is going to, or the sedation mixture that the patient is going to inhale from the sedation machine, will have at least 30% oxygen. And this I'm saying when you're taking the nitrous level to 70%, the remaining 30% is going to be oxygen. Now, very rarely do we do this. I mean, most of the times you will notice that we do the sedation at 30% or 20% nitrous itself. So which means remaining 70% to 80% is only oxygen. Okay. So you will notice that the patient is not, oxygen deprived at any point of time. And this is a small experiment to show you. You can notice that when I'm trying to raise nitrous, even the oxygen will raise along with it. All right. Meaning the machine itself is designed in such a way that it will try to maintain an adequate level of oxygen along with the ministry. You cannot rig and change it. Okay. And so that's the best part of this. That's why you require specialized machines to deliver nitrous oxide inhalation, sedation, and this safety feature is there in most of the machines. Now, what if the oxygen suddenly stops? So I'm just trying to mimic this situation. You see here, I close the oxygen, assuming that the oxygen becomes empty during the procedure. You can see this is the oxygen level and this is the nitrous level. Above the blue knob is nitrous, above the white knob is oxygen. Can you all hear the alarm sound? There's a kick sound. The machine is trying to tell us that the oxygen levels are dropping down. Okay. And beyond the threshold, I want you to watch this flow meter. Okay. Above O2 is O2. You see, when the oxygen goes below, it shuts off the nitrous. You can see the nitrous has become zero now. Even without anybody touching or operating the machine, you will notice that the machine will shut down nitrous if the oxygen level is low. And what will happen is that another valve will start opening so that the patient will start breathing the ambient air in the atmosphere. Okay, so the machines are so safe that at no point of time will your patient be deprived of any kind of a gas, any kind of air or oxygen. Okay, so there are many more safety features like emergency air inlet, the alarms. If you want extra oxygen, there's an oxygen flush button. There are so many features in these machines. All right, so when we get a point where we are able to have a multi-hour session, we'll discuss this in detail. Any age-related restrictions? I just told you I start my sedation session with this 93-year young patient. All right, you could notice that there is no, restriction at all. All right. And if the patient can communicate, if the child can communicate properly with you, then you can use nitrous oxide inhalation sedation, which means I've used it even in children who are 2.5 years of age. As far as the communication is good, if you're able to communicate and convey why you are placing the hood on top of the nose to the child through some way, you can go ahead and use nitrous oxide inhalation sedation. Now the question arises, what if the patient is going to push away the nasal hood? What if they don't accept behavioral issues? Now, this is where we go into advanced level of sedations. Of course, you will notice that just like how we do regular behavior management, we may have to do that. See, this is a very common scene in my clinic. All right, you will notice that the patient is crying, the father is consoling the child. The child is refusing to accept the nasal hood. All right. So some behavior management methods, like you're telling the child, you have to accept it. All right. And you will notice that I'm being very strict with the child. I'm using some amount of voice control here and telling the child, if you do not accept, you can tell whatever you wish to tell. Okay. And now the child slowly accepts, but still keeps crying. I'm slowly introducing nitrous. I'm asking the child, if you are in a good behavior, your father is going to come and join you. Something, whatever works in your practice. All right. So slowly the child is starting to listen to me. And once the child shows good behavior, do not immediately start the procedure. You see, I'm appreciating this kid. I'm telling this kid, you fantastic, giving the child a star. I'm appreciating this child, a small suitable gift. That's how you go ahead with the treatment. All right. And now you notice that we are slowly the child is becoming more and more suggestive, accepting. Your suggestibility is improving because of the sedation. If you notice the eyes, you will notice that eyes are the best organ in the body to notice the presence of sedation. Slowly, steadily, you're able to start the local anesthetic. You will notice that the child is able to accept local anesthesia in a better way. And I'm just going to skip this video. What we did was nothing but simple crowns and restorations and another extraction probably for this kid. All right. It's the usual pediatric dentistry stuff that we went on to do. We placed a crown, we did a restoration, And then, we also did some extraction for this kid. Okay. So that's about it. So if the child is not accepting the nasal hood, try first behavior management. If the child is able to accept, very well and good. Otherwise, the next step is, the next method is to, I'm sorry, I think this video is not playing, so I'll show you another different video. I mean, this again is a common thing that can happen in your practice wherein the child kicks the father and, common is right. So we try to convince the kid, I'm just going to fast forward this video. Child abuses us, scolds us, and eventually you will notice that the child accepts the dental treatment because uh, I mean, uh, we gave him an intranasal sedative. Now the child is able to accept. Fast forwarding the video, and slowly you will notice that he becomes calm enough to accept the inhalation sedation. On to do his treatment, and eventually you will notice that we were able to complete the treatment for him. So that's how the treatment went. So, and this patient also gave me a fantastic review for me in Google, and it's a wonderful moment, all right, when you are able to do something good like this for a child. Another kid with trauma does not accept, he's not accepting the nitrous oxide inhalation sedation because, of course, when he had a trauma, he just went and rammed on a hard object. Eye gets injured, teeth gets injured. Eye versus teeth. The patient is obviously going to go to the eye first. There for close to 1 hour, the patient was held against his will and multiple procedures was done. Now, when they came to the dental part, again, you will notice that the child carries the same negative memories. So he's not allowing us to place the nitrous oxide hood at all. So we had to give him some oral midazolam. You could see how the sedation in his eye, the kind of sign which we say, the droopy eyelid sign. All right. So that, you could see that there. And then we started once somebody's phone is actually, I think it needs to be muted. All right. So you can notice that now he's able to accept the nasal hood, and we went on to place anesthesia, and we went on to do the procedure for him. All right. So, I'm not going to get into the details of the procedure. It was a complex trauma management. There was a subgingival fracture extending. This is how we started. And interesting here is that you will notice that actually, uh, can we mute that participant actually? Is it possible, admin? There's some interference. Yeah. If you notice this slide, you will notice here that actually the fragmented tooth was splintered by the father by using paper gum. You know, you use paper gum, brown color paper gum. He applied brown color paper gum on the teeth and he made it just stick and stay there. Okay, so that was how the patient came to us. We were able to reattach the same fragment, and we built up the remaining composite. And then right now you will notice that, we did some partial pulpectomy. We did the partial pulpectomy for this kid. That's biodentine here at this level, which we placed. And this is, the 6 months follow-up. You will notice that the periapical region is, it's a kind of healing well. You could see that, that his portion is also healing well. And now what we did was we chopped off the incisal edge in order to extrude the tooth orthodontically. So he's undergoing orthodontic treatment to extrude the tooth out of the gingiva so that the junction that is present subgingivally can be seen more superficially, and it can be kept in a self-cleansable area. Okay. Now, the next question arises, when to avoid nitrous oxide inhalation sedation. Now, you have to understand that there are relative contraindications and absolute contraindications. Uh, COPD, severe COPD, which means chronic bronchitis and bronchiectasis, you have to avoid nitrous oxide inhalation sedation. If there is upper respiratory tract infection, where there's obviously the patient's ability to breathe is going to be limited. So wait for the cold to get corrected and then start with the nitrous oxide inhalation. Any recent middle ear pain, again, be careful. You can take a screenshot of this slide. This is when, you are going to avoid nitrous oxide inhalation sedation as far as possible. Okay. Are there other methods of sedation that one can practice? Of course, you have intranasal sedation as well. I mean, this child is so young to understand what is nitrous oxide nasal route. So we went on to treat this child under intranasal sedation, and we had to treat his lower anterior, where he had a traumatic incident. You can see here, he just pulled a thread biting as when he was biting the lower anterior. The elder sibling pulled the thread as a younger sibling was biting the thread. So you could see the bone loss distal to the lateral incisor, okay, between the canine and the lateral incisor. All right. Usually I extract these teeth, but then the patient requested me to somehow go ahead with the treatment. Now you can see the 3-month follow-up. You could see the amount of bone that has grown between the canine and lateral incisor. I mean, quickly you could see here, I mean, the bone loss and then the bone fill. You could see the difference, right? All right. And when you have severe behavioral issues like these, where the child is not going to accept any other form of treatment, of course, either like this, or you can very well notice that such patients are better managed under IV sedation, call an anesthetist and get the treatment done under IV sedation. Okay. That's the best way to manage these patients. Or when you have special children with severe behavioral issues, I mean, again, you will notice that IV sedation is a fantastic tool to operate, to work them. So what's the best part of nitrous oxide? You will notice that it does not induce deeper levels of sedation, minimal or moderate only. So even if you make a mistake, you'll definitely not push the patient into deeper levels of sedation. Whereas all of the sedation measures can, even oral sedation, intranasal, intravenous, can take the patient into deeper levels of sedation. So you need some amount of good training or the presence of a specialist to do this. All right. So you can start with noise, and when you start with noise, I'm pretty sure this is going to be the type of practice that you would go with. I mean, you will notice that you're giving local anesthetic, and the patient is just relaxed and calm. No hand is moving. Everything is appearing fine. This is going to be the way you're going to go ahead. So, there is more to explore in the field of sedation within this small time, whatever best I could. I hope I gave you some knowledge about how sedation can influence your practice. This is a link for a YouTube video of mine. I'm not sure if this QR code is working. If it's not working, do message me on Instagram. I'll be more than happy to help you out. All right, this is a YouTube video where I talk in depth about how to manage people under deeper levels of sedation and all that. So to conclude, sedation is a very valuable option that aids in stress-free dental treatment. It improves the quality of treatment, even improves the way you deliver treatment to patients. All right. And you can follow me on Instagram. That's my Instagram ID. All right. And I'm very much accessible on Instagram. If you have any doubts, any issues, you can always message me. Give me some time. I definitely do reply back to my messages. And just another reminder, in case you wish to learn more about sedation, do look into our program. I mean, this is the next program that's coming in our academy. You'll have many such programs constantly coming up. Thank you one and all for being a great audience, for very peacefully and for very patiently listening to this lecture. I mean, thanks for taking time out of your night schedule and listening to this. And thanks to the organizers of IADPE, for giving me this valuable opportunity. My heartfelt thanks to you. And I'm sure I hope I did enough justice for your 100th webinar. Thank you one and all.
Hello.
Yes, doctor, I can hear you.
Thank you so much, doctor.
Yes, doctor. I hope I could finish it on time. Yeah, I just maybe overshot by 5 minutes, I believe. Yeah.
Yeah, it's fine, doctor. Thank you so much for this wonderful and highly informative session. Your insight on improving patient experience through conscious sedation have provided us the valuable clinical knowledge and practical strategies that can be implemented in our daily practice. The way you explain the principles, benefits, and applications of conscious sedation has undoubtedly enriched our understanding of patient centered dental care. I'm sure all of these participants will leave this session with meaningful takeaways and renewed confidence with managing anxious and apprehensive patients for effectively. On behalf of IATP, I extend our heartfelt gratitude for your time, dedication, and willingness to share your expertise with us. We would also like to thank all the doctors who joined us today for the active participation and patient listening. Your continuous support motivates us to bring more quality educational programs through our master series. To stay updated on our upcoming webinars or workshops and educational activities, please do visit iadp.org and follow us on Instagram and Facebook pages. If you have missed any of our previous sessions, do check out our YouTube channel and subscribe for future updates. Once again, thank you, Doctor. Thank you, everyone, for being a part of this today's session. Thank you, Doctor.
Yeah. Doctor, can I
Have
just
a
add something? I
yeah.
believe if because of want of time, if we are closing this session and we are not able to take up any questions, the participants can actually
Yes,
message me.
yeah. You can
They can
proceed if you
message
are
me either on
okay.
my social media channel, or they can message me in any other way. They can mail me as well, and I'll be glad to take up their questions. All right.
Oh, it's
Thank
pleasure,
you.
Doctor.
Yeah.
Once again, thank you. Thank everyone for being a part of today's session. Have a wonderful evening and a great week ahead. Stay safe, keep learning, and keep inspiring. Good night.